Hello and welcome to our next lecture, the psychological model of addiction. We already discussed a moral model and you know what it is now and that it's not used today by psychologists or therapists. We will have a look at the models that represent something like biological views or medical disease model. So we'll have a look at the addiction from various standpoints. And in this lecture, we'll have a look at it from the psychological point of view. The psychological model of addiction implies that a person uses alcohol or drug substance to cope with negative experiences in their life, which could have originated recently or long time ago in their childhood or adolescence. Some people jokingly call drinking alcohol for those reasons as self-medication. And they won't be far off. So what are they trying to self-medicate? Firstly, of course, it's the expression of their own emotions. Whether they prefer to block the emotions that are connected to the traumatic experiences through alcohol or drugs, or whether they cannot express their current emotions for various reasons. This is one of the reasons for the alcohol overconsumption or drug addiction. Secondly, it is related to difficulty in self-care. Many people become drug or alcohol dependent because they don't know how to calm or soothe themselves in any other way. Instead, they use alcohol or drugs to make themselves feeling better. Less stressed, less anxious, less worrying, or even less excited. Thirdly, it's about the person's self-esteem. Many individuals have low self-esteem and poor sense of self-worth. They feel they are not confident enough. They don't believe that they are strong enough to cope with difficulties. They might not believe that they can achieve anything in life, and so on. Drinking alcohol or using certain substances give them that feeling of enhanced self-esteem and self-confidence. And fourthly, they self-medicate to cope with troubled relationships. Whether it is about past or current relationship, short-term or long-term, if they caused any negative experiences to us, we have to cope with them somehow, and in some cases to rebuild them too. Interestingly, the theory proposes that the relationship that the addict is forming with a substance, whether it is an alcohol or drug, this relationship is replacing or representing the troubled relationship that they have or they've had with someone else, particularly someone close like their parent or a child. Many people with addiction have broken relationships with their families, so their addiction often represents those relationships. So what else do you need to know about the psychological model of addiction? This model suggests that the person's addiction is usually a secondary factor. The first one is the person's psychological issues, past traumas, relationship problems, and so on. So the first and most important factor here is the person's psychological well-being, which would be addressed first and foremost. In this model, the therapist would view the addiction as a coping mechanism rather than a maladaptive or even shameful behavior. This model also suggests that addictive personality is real, and not everyone has that. Though genetic and social factors would be important to consider when thinking of addictive personality. Of course, as any other model, the psychological model of addiction has its own advantages and disadvantages. For example, this model does not make the person with addiction as someone who should be shamed because of their lack of willpower, as in the moral model. Instead, it addresses underlying reasons for the substance abuse, which makes recovery as something more achievable. And this model is used successfully in the therapeutic treatments of addictions. On the other hand, when using this model in therapy, it is important to understand that the person with addiction is also responsible for their behavior too. It's not about blaming others and their troubled childhood, as this model suggests. And another disadvantage of this model is that This model is not considered to be a holistic model. It doesn't view the person from various points such as social, genetic, family-oriented, spiritual, and so on. It only sees the potential psychological problems that are connected to the person's addiction, which can be seen as too narrow approach for some. Some psychological theories also view the addiction through the reinforcement theory. This theory implies that a person can engage into a behavior on a more regular basis when they are receiving pleasure or some reward from it. On the other hand, people tend to minimize that behavior that results in some sort of punishment. So when you look at the addiction through the lens of the reinforcement theory, then you would see that the person with addiction started the excessive use of stimulants because they were getting rewarded in some way or another. What is the reward here? Well, as simple as the sense of pleasure from the drug, an enhanced self-esteem, a feeling of coping with any other problem. And as a result of this happening, the person tends to repeat their behavior more and more often, which eventually leads to the addiction. Well, this is it for the psychological model of addiction. And next we will discuss the medical disease model in our next lecture. See you there.